Good afternoon, and thank you for joining us. I'll turn to Dr. Walensky and Dr. Fauci in just a moment. First, I want to start with a brief update on our efforts to help states that are battling surging cases driven by the Delta variant, particularly those states that have also been hit by Hurricane Ida. First, our thoughts are with those who have been impacted by the hurricane. And we're leveraging our COVID-19 surge response to help in any way that we can. As part of our surge response effort, over 350 EMTs, doctors, nurses, and other healthcare personnel have been providing emergency medical care on the ground in the Gulf states of Louisiana, Mississippi, and Alabama. And since July, we've sent ventilators, therapeutics, and ambulances to support the strained healthcare systems in these states as they respond to Delta. Our personnel remained on the ground as Hurricane Ida made landfall and are mobilized in the aftermath of the storm, augmenting the strong efforts of hardworking local healthcare personnel. We are providing critical clinical care, conducting patient movement to relieve strained hospitals, and continuing to administer treatment for COVID-19 patients. At the same time, our whole-of-government effort to respond to help states with Delta outbreaks continues. In fact, to date, COVID-19 surge response teams are working with 18 states, pulling in personnel, resources, supplies, and expertise from across the federal government, including from HHS, CDC, FEMA, DOD, and the VA to address state-specific needs. We've deployed more than 700 personnel, surged critical supplies to health systems, expanded testing capacity, and importantly, expanded the use of life-saving therapeutics. In fact, in the month of August, we shipped more than 670,000 courses of therapeutic treatments. That's 6 times as many as we shipped in July. These therapeutics prevent hospitalization and save lives. Our message to all states, tribes, and territories is clear. We stand ready to help you in any way we can to respond to the Delta variant. As we respond to surges, we remain laser focused on getting more shots in arms, and we continue to build momentum. Back in mid-July, we were averaging 500,000 vaccinations per day. Today, we're averaging 900,000. That's an 80% increase in the number of shots we're getting into arms each and every day. Last week, we got over 6 million shots, the biggest weekly total since July 5th. Importantly, we've accelerated the pace of first shots. In August, we got over 14 million. That's almost 4 million more first shots in August compared to the prior month, July. We continue to push for more vaccination progress, including through vaccination requirements. The President first adopted vaccination requirements for federal workers last month. And now over 800 colleges and universities, over 200 healthcare employers, small and large businesses across the country, and dozens of state and local governments and school districts have stepped up to follow the President's lead. Tens of millions of Americans are now covered by vaccination requirements. And these requirements are already working to get more people vaccinated. In Washington state, the weekly vaccination rate jumped 34% after the state announced vaccination requirements for state employees, teachers, and school staff, healthcare workers, and colleges and universities. Businesses are seeing strong results. On August 3rd, when Arkansas-based Tyson Foods announced its employees would need to be vaccinated no later than November 1st, only 45% of its workforce had gotten a shot. Today, that number stands at 72%. That's a 60% increase in less than a month. Notably, the share of job postings that require vaccinations are up 90%, according to Indeed.com, a popular job search site. Bottom line, vaccination requirements work. They drive up vaccination rates. And we need more businesses and other employers, including healthcare systems, school districts, colleges and universities, to step up and do their part to help end the pandemic faster. We need more individuals to step up too. As people across the country prepare for Labor Day weekend, it's critical that being vaccinated is part of their pre-holiday checklist. Getting vaccinated is free. It's easy and convenient. It's safe and effective. And it's never, ever been more important. So please, if you are not fully vaccinated, don't put it off any longer. Visit vaccines.gov or text your zip code to 438-829. 438-829. That will enable you to find a site near you. Do your part. Get your shot today for yourself and your loved ones, for your community and our country. With that, I'll turn it over to Dr. Walensky. Dr. Walensky.
Thank you, Jeff, and good afternoon. Let's begin with an overview of the data. Our 7-day average of cases is about 129,000 cases per day. Our 7-day average of hospital admissions is about 11,500 cases per day. And our 7-day average of daily deaths has increased to 896 per day. As we prepare for more of our children to return to school after Labor Day, CDC has strong and detailed guidelines that should be implemented to promote our children's safety in the classroom. Let me reiterate what they are. Most importantly, CDC recommends that everyone eligible for vaccination be vaccinated before school starts. If you or your vaccine-eligible child is not yet vaccinated, it is never too late to begin your vaccine series. Next, universal masking is critically important in schools for students, teachers, staff, and visitors, regardless of vaccination status. CDC also recommends school employ additional key strategies in school to keep kids safe, including improved ventilation, physical distancing, and establishing screening programs for students and teachers. Federal resources have been made available to help schools implement these recommendations. Parents should educate themselves on the CDC's recommendations for K-12 school operations. Parents can ask questions of their school administrators and learn how these steps will be implemented in their district. Parents should encourage their children to wear masks when in public indoor settings. And finally, and perhaps most importantly, parents can protect their children by getting vaccinated themselves. This will create a protective bubble around their children who are not yet eligible for their own vaccine. As we approach the Labor Day holiday weekend, I want to share ways that Americans can keep their families and themselves safe over the long holiday weekend. First, if gathering with family and friends, remember that spending time outside with others who are vaccinated will help to prevent transmission. Throughout the pandemic, we have seen that the vast majority of transmission takes place among unvaccinated people in closed indoor settings. Second, when in public indoor settings, please wear a mask, vaccinated or unvaccinated. As I've said before, masks are not forever, but they are for now.
Feels like forever.
The transmissibility of the Delta variant and the significant community transmission in this country, wearing a mask is the easiest way for anyone, regardless of your vaccination status, to slow the spread of disease. Third, talk with family and friends who are still unvaccinated about the benefits of the vaccine and consider taking them to get vaccinated over the long holiday weekend.
That means have a round of drinks of everyone like yourself.
The Advisory Committee on Immunization Practices reviewed the recent FDA decision to approve the Pfizer COVID vaccine, and we have updated our recommendations. I'm delighted to say that we now have a fully FDA-approved, CDC-recommended vaccine available. For anyone who's been waiting to get vaccinated until we had more evidence on safety and effectiveness, I hope yesterday's announcement will have you join the more than 170 million people who have decided to protect themselves against COVID-19 by getting vaccinated.
What did they announce yesterday?
Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. I would like to now update you on COVID-19 vaccination in pregnancy. Next slide. It is very clear now, as I'll show you in a moment, that there are severe adverse outcomes for mother and baby during COVID-19 infection. Therefore, it is extremely important for pregnant women and women planning to get pregnant to get vaccinated.
This guy is the devil.
Let's look at these adverse events that I mentioned a moment ago. From this CDC MMWR from over a year ago, if you look at an analysis of about 400,000 women and look at the risk ratio of things like intensive care admission, invasive ventilation, extracorporeal membrane oxygenation or ECMO, or death, they all have an increased risk ratio. Next slide. If you look at total numbers, total number of cases of pregnant women with COVID-19 from January 2020 to August 2021, there have been about 110,000 cases, about 19,000 hospitalizations, and 131 deaths. Indeed, COVID-19 in pregnancy is serious. Next slide. Let's take a look at some of those risk factors which increase the possibility and probability of severe illness. One is age, 25 years of age and older, occupation, pre-pregnancy obesity, and chronic diseases like lung disease, hypertension, and pregestational diabetes mellitus. Next slide. What about the safety of COVID-19 vaccines in pregnant women? In over 35,000 participants that were followed in the V-Safe, there were no obvious safety signals among pregnant women who received an mRNA COVID-19 vaccine. Next slide. And if you look at the immunogenicity in pregnant and lactating women, you see potent antibody and T-cell responses, as well as cross-reactive immune response against a number of variants. Next slide. If you look then at breast milk, another advantage of getting a pregnant woman vaccinated is that when that woman breastfeeds, it passes by passive immunization, a specific IgA and IgG antibodies in breast milk that was seen in a study with a 6-week follow-up period. Again, antibodies found in breast milk show strong neutralization of virus, protecting your newborn baby. Next slide. And so if you look at the strong statement of 23 leading organizations who strongly urge all pregnant individuals, as well as recently pregnant, planning to become pregnant, or lactating and other eligible individuals to be vaccinated. The bottom line, get vaccinated. Back to you, Jeff.
Wonderful. Thank you, doctors. Let's open it up for a few questions. First question.
We'll go to Yamiche Alcindor at PBS.
Hi, thanks so much for taking my question. I have a question about, in some ways, the worries that you have with back to school children. Is there anything that you're seeing now in the States, given the parents' apprehension to send their kids back to school, that you can talk about as bubbling up, given that some medical professionals are saying that they're seeing more children be hospitalized? And I'm also wondering if you can speak at all to the idea that some states are seeing ICU bed shortages because of COVID. Is there any sort of resources being shared to try to figure out what's going on there and to address it? Dr.
Walensky?
Sure, absolutely. Thank you, Yamiche. First of all, we have, as I mentioned in my remarks, strict and detailed guidance as to how to keep our children safe in school. This includes vaccination of everybody who is eligible, wearing masks in school, and we are seeing in some schools, as well as distancing, screening protocols. We are seeing schools that are not following these guidance, specifically not masking, not having lower rates of vaccination, are dealing with outbreaks, especially in the context of this very transmissible Delta variant. And we are encouraging those schools to follow our guidance and to follow our assistance as they manage those outbreaks to get their kids safely back into school. With regard to pediatric hospitalizations, we know know that there's an absolute number of children, because of this highly transmissible variant, an absolute number of children that are infected now with SARS-CoV-2. And because of that absolute number, there's a larger number of children in the hospital. We're also simultaneously dealing with an RSV outbreak that is occurring in children now that's atypical for this season, but is also leading to more occupancy of those pediatric hospital beds. Thank you.
I would say on hospital capacity, the last part of your question, our surge response teams are in constant communication with governors, states, and local health officials. And as I mentioned, we've deployed 700 federal personnel to support states in their surge response and in their hospital staffing capacity. This includes doctors, nurses, EMS, and others. And we stand ready to provide states with additional resources, medical support teams, technical assistance, more supplies, and as we've talked about, life-saving therapeutics that can keep people out of the hospital and save lives. Next question.
Go to Zeke Miller at the Associated Press.
Thanks for taking my question. You mentioned the upcoming holiday weekend. Given the surge in cases, should Americans reconsider travel this holiday weekend? And then more broadly, we've seen from the State Department and CDC new travel warnings for countries that are doing better against COVID than the United States. Why hasn't the administration taken a tougher stance in terms of advising Americans not to travel the same way it is advising them not to travel to countries like Canada or places like Puerto Rico?
This guy's asking for mandates.
Yeah, we provide our travel health. We receive travel health notices and carefully watch those daily. Those look at testing capacity as well as case rates, and we update our travel guidance by country in real time. We have actually articulated that people who are fully vaccinated and who are wearing masks can travel, although given where we are with disease transmission right now, we would say that people need to take these risks into their own consideration as they think about traveling. First and foremost, if you are unvaccinated, we would recommend not traveling.
Next question.
Go to Meg Tyrell at CNBC.
Thank you. I'm hoping you can comment on these reports we've seen today and the FDA confirming that two of the top regulators in the vaccine unit there are retiring in October and November, Marian Gruber and Phil Krause. A number of organizations are reporting that in part they're resigning because the FDA hasn't been as involved in the booster discussion that CDC in some ways is front running them, and in some ways the White House is front running booster discussion. I know you've addressed this before, Jeff, but if you could tell us, are you concerned in general about these resignations affecting trust in the FDA and the vaccine process, and also about the ability for the FDA to quickly review vaccines, especially as the review for kids is coming up around that time? Thanks.
Yeah, okay. Thank you for the question. As the president said last week, FDA is the gold standard, and we are all grateful for the tireless work of the senior team and the whole staff at FDA, especially during the pandemic. FDA has strong leadership in Dr. Woodcock and Dr. Peter Marks at the Center for Biologics Evaluation and Research, and their critical work continues as we work to get safe and effective vaccines to the American people. The booster decision, which you referenced, as we've talked about, that decision was made by and announced by the nation's leading public health officials, including Dr. Walensky, Dr. Fauci, Surgeon General Vivek Murthy, Dr. Janet Woodcock, the FDA acting commissioner, Dr. Francis Collins, Dr. Kessler, and others. And as our medical experts laid out, having reviewed all the available data, it is in their clinical judgment that it is time to prepare Americans for a booster shot. We announced our approach in order to stay ahead of the virus, give states and pharmacies time to plan, and to be transparent with the American people as to the latest data and expert clinical judgments from the team to give them time to do their own planning. We have also been very clear throughout that this is pending FDA conducting an independent evaluation and CDC's panel of outside experts issuing a booster dose recommendation. So, The bottom line, this virus has proven to be unpredictable, and we want to stay ahead of it and plan for every scenario. And that's been our approach from day one, and will continue to be our approach. Next question.
Cheyenne Haslett, ABC.
Hi, thanks for taking my question. There were comments at yesterday's ACIP meeting that the administration doesn't seem to have enough data to recommend boosters. I'm wondering if you're confident that enough data will be available by September 20th to reassure and back that decision.
Dr. Walensky?
Yeah, happy to take that. So the ACIP reviewed data yesterday that was the data that we reviewed just a few weeks ago that looked at increased waning with regard to the vaccine effectiveness for infection and some suggestion that there was increased waning of vaccine effectiveness against hospitalization. The ACIP did not review international data that actually has led us to be even more concerned about increased risk of vaccine effectiveness waning against hospitalization, severe disease, and death. They will be reviewing that as well. But that is it is our own data as well as international data that has led us to be concerned that the waning we're seeing for infection will soon lead to waning that we would see for hospitalization, severe disease, and death, which is why it's so critical now to plan ahead to remain ahead of the virus.
Next question.
This will be our last question. We'll go to
Everything she just said is total nonsense. They've only studied and been able to show in numbers that they made up that it lessens the impact of symptoms. That's all it does. It doesn't do anything else.
There are in areas that have been impacted by IDA, and what the plan is to either prevent or minimize those doses from spoiling due to power outages and the cold storage requirements. So, thank you.
Well, the number one concern right now, as we talked earlier, is about those who have suffered losses and are in danger from the hurricane. So our thoughts go out to them. I know our operations team is working very closely with all of the states to provide any support they can, including to make sure that the vaccines continue to be stored safely and administered where appropriate. So the team is all over that, doing anything we can to help with the hurricane, including protecting the vaccines and where appropriate, continuing to administer vaccinations. Thank you for today. We'll look forward to a briefing later in the week. Thank you, everybody.
These people are liars. All right, so I think let me check the schedule. So in 20 minutes, old man Walter Biden is supposed to get up and speak about how the war has ended in Afghanistan. I like how they word it that way because they don't want to say, oh, we've abandoned all the Americans that are still in Afghanistan after they didn't pay their $2,000 plane ticket. And then at 3:30, we got press briefing with Jen Balsecki. And that's all we have on the schedule today. I don't know what else is going on. I know that there is a ton of truckers who have shut down for today. They are not transporting, and it is to stand against the mandates. Somebody mentioned in the Discord that there's protesting going on or something about it. I have not found that or heard that other than that individual mentioning it to me. But because they are a hooligan, I'm going to look into it. I have reason to believe that it is true. So we will be looking for that today as well. Oh, I don't know. I don't know if we should stay on for 20 minutes. I don't really have much else to say. We've heard these lies so many times. I actually just posted a video in the C19 chat on Discord from a doctor that's here in Michigan, basically going through what the studies have and have not actually found as far as getting the jab. And I mean, we all know it's nonsense. It's more hazardous than anything, but they really go through it, and then it really details where the fat to meat ratio is and all this stuff. They keep telling us, like, you do what you're told, or else it's your fault that we have to shut the schools down, or it's your fault we have to shut everything down. And it doesn't, it's totally unrelated. Like, it's totally unrelated. Like, you better have car insurance, or else you can't fly on this airplane, or else you can't ride this roller coaster. Like, it's just totally unrelated. People are really naive for believing that stuff. Especially when the information is so available. We all have internet. It's super crazy. But I think what we're going to do is we're going to shut this down. But before we do, I want to show you guys this new logo that we're going to put on shirts and all kinds of other items. I was going to put it on shirts yesterday, but I think I'm going to start a new merch store that has a little less restrictions. There's a merch store that's not taking everybody's crap down. Like, I have to fight mine every step of the way. Every time I put a logo up, they take it down. It takes me like 3 hours to get the listing finished just for them to turn around and take it down. And then when they take it down, I have to write them an email and explain that I own the rights to the images and all this stuff. And then they're basically like, oops, we made a mistake. And then I have to do it all over again. So almost every image that's on my store took 6 or more hours to get it there. And that's rough. That's rough. I have lots of images in the catalog that have not been released yet. And it's why it takes so long for me to even put anything out. It doesn't feel enjoyable at all, to sit here and be like, okay, for the next 6 hours and 2 emails, I will be doing this. And it makes me not want to do it. And of course I have to fight through it and get it done so we can all show how proud we are to be hardcore truthers. But yeah, so I'm going to show you guys the new image. And then I think what I'll do is I'll start the new merch store and I will make that the first design on there. So just a moment. This is going to be the new image that is going on shirts. It'll also be on accessories and a bunch of other stuff. But this is going to be the brand new design. I think what we're going to do is we're going to do white shirts, black logos, and then we will also do the opposite. We'll do white logos on black shirts. I prefer to have black shirts because if I get white shirts, then I mess them all up. But I know a lot of people write me and ask, why is everything in black and stuff like that. So I think what we're going to do, depending on how this new merch store is, we're going to try and have more variation on colors of shirts and stuff like that, because especially for you ladies, I know you girls don't want to wear black all day, especially in the hot sun and stuff like that. So we're going to try and have some more options available. But this is the new design. Had a hooligan that works with me now and works on designs and stuff, and this is the first 2A design that we've come up with, and this will be available probably within a week or so, depending on how this new merch store goes. If they give me any trouble, we'll just put it up on the old one and I'll fight these guys until they allow me to keep the listing up. So this is I guess like a pre-revealing of the new logo that we're gonna have available soon. I'm excited to order it. I need some new shirts. I only got like 10 or 12 shirts and most of them are doubles. So I'm excited to get something that's Pro 2A, especially for the next March. I do plan on marching on this upcoming Tuesday. I'm not sure. Honky Kong, yes, it will be available in long sleeve. Short sleeve, long sleeve, zipper hoodie, pullover hoodie, probably leggings and everything. It would be available in everything. We'd be able to get cups and posters and everything. Patty, yes, it will probably be available in XXL. I try to provide it in all sizes, but it's really up to the distributor if they have those sizes in stock. I know right now you can't get tank tops in XL or XXL right now, unless they've restocked it, because I was going to order some tank tops, especially for the March, and I was not able to get any in my size. It was like the biggest they had was either a medium or a large, and that wasn't going to work. It wasn't going to work. I was going to look like I would be busting out of that thing, so I didn't get to order any. But hopefully this new merch store keeps in stock a little bit better, and they're a little bit better with us. But yeah, this Tuesday I do plan on marching. I don't know what the weather's going to be. I don't know if my friend's going to be able to come with me. I don't know if anyone's going to join me, but I have full intentions of going out there, even if I have to do it on my own and marching with the flag. Of course, I'll have the shield on me, and I'll have God with me, so it's not really like I'll be alone. I'm not really that worried about it. But those are my intentions for the upcoming Tuesday, and we will just see how it goes. I like taking my flag for a walk. It gets stuffy sitting here in the house all day. You need to go take your flag for a walk. I encourage you guys to do the same thing. If you can't join me, be the person that stands up in your community and does it first. It's not a big deal. I know it seems kind of scary at first, but it's not. It's really not. If you can take your dog for a walk, you can take your flag for a walk. Do both. Then you'll really be safe. It's good. It's inspiring to your community. So, all right. So what we're going to do is we're going to shut this down. We will be going live again in about 10 minutes with old man Walter Biden. Hopefully I see all of you there. Make sure you guys run the likes up when we start the new live, and encourage others to do the same so we can get some new viewers. Right now YouTube is starting to put their boots down on me. Even though I see so many people showing love and showing up every day and clicking the like button and, you know, showing support, for some reason we have not gained 1 subscriber in 3 or 4 days. And that seems highly unlikely for the amount of people that we have coming in every day. So I think what's happening is YouTube is starting to figure out that we're going live more often again. And so they're starting to limit my subscriber list. Now they can only do it for so long. After a week or so, it'll break loose. And then all of a sudden I'll go up like 1,000 or 2,000 subscribers. So if you guys haven't subscribed, please make sure you subscribe. Eventually this algorithm will break, and they will have to show me the actual numbers of people that are subscribing. And hopefully we can get away from, well, we can grow basically is what I'm trying to say. Because we've been stuck here at like 51K for like almost 8 months now. They will not let us grow beyond it. And it's not because people are not showing up. It's not because people are leaving. It's because YouTube is holding us still. Because the higher our numbers are, the higher percentage of people receive notifications, the higher amount of people who have never seen us before find us. And so they're trying to stop that from happening. But all we can do is keep pushing. Just keep pushing forward. Eventually it will break loose, and we will grow. Big shout out to everyone on alternative platforms. So far we have not been targeted on those. I know a lot of people don't like Twitch, and they have a lot of bad stuff to say about Twitch, but Twitch has never done anything wrong to us. The only time they ever marked us is when Kyle did what he did, because we streamed it live, and once that guy's arm was hanging by tendons, Twitch shut us down for like a month. For like a whole month they wouldn't let us go live. But I mean, compared to YouTube's communism, wasn't that bad. Odyssey, Rumble, they don't give us no trouble at all. It's kind of quirky to get the live going, but other than that, they don't give us no issues. Facebook, haven't encountered any issues with them. I'm sure that there will be some, but that's also the platform where you see Antifa walking around with pew-pews on them and, you know, roughing people up and setting buildings on fire, and obviously they don't get banned. So I'm sure it's more like trigger words will cause us issues, and I've become kind of used to using alternative words for what we're trying to discuss. And so I don't worry about that as much. And even if I was to lose Facebook, I'm not really that worried about it. I appreciate everyone that watches on Facebook. But really, it's just to reach more people to get on these other platforms that are actually meant for live streaming. Facebook is eating itself. It's not going to be around much longer. Not unless they change their ways. I don't use Facebook for nothing but streaming on. I can't write a post or nothing. I open my mouth on Facebook and they give me warning labels and all kinds of stuff. So they can go hardcore fuck themselves. But yeah, so about 9 minutes or so, we'll go live with old man Walter Biden. Hopefully he shows up, because he never wants to show up. I mean, he's just, you know, supposedly running the country here, but who knows? But that's our goal. See you guys in about 9 minutes or so with old man Walter Biden. He's going to talk about how we're no longer in Afghanistan. And I'm sure it's going to be really upsetting to a lot of people, but we still need to be able to watch it and see, because a lot of times they'll let some truth slip out, and they'll be able to tell us what's going to happen next, even though it's most of the time unintentionally. So I will see you guys then. Thank you guys so much for being here. Big shout out to everyone that made donations, joined the membership program, or purchased any merch. I really appreciate all of you. I would not be able to do this without you. So thank you guys so much. I will see you on the next live. And until then, stand tall, shine bright, and that's a wrap.